12 alarming signs of clogged arteries. Arteries can face issues such as atherosclerosis, hypertension, aneurysm, and thrombosis, affecting blood flow and contributing to cardiovascular complications. Arteries are blood vessels responsible for transporting oxygen-rich blood from the heart to all parts of the body. Oxygen is necessary for cells to perform their metabolic activities and sustain the healthy functioning of all tissues and organs in the body. Atherosclerosis is the accumulation of fatty plaques, cholesterol, and other substances on the walls of arteries, compromising blood flow due to artery blockage. Clogged arteries can lead to severe complications such as heart attacks and strokes, due to the obstruction of blood flow that compromises the supply of oxygen and nutrients to the tissues. So, what are the warning signs that our body gives when arteries are clogged? Let's start by talking about chest pain, known as angina. The process begins with the accumulation of fatty plaques on the walls of the coronary arteries, narrowing blood vessels and reducing blood flow. This creates an environment conducive to inflammation and clot formation, resulting in partial or complete blockages. When the demand for oxygen in the heart increases, such as during physical exercise, the heart muscle does not receive the necessary amount of oxygen, triggering chest pain. Angina often manifests as a sensation of tightness, pressure, or burning in the chest, and its intensity and duration can vary. Another symptom you may feel is shortness of breath. Clogged arteries compromise blood flow to the lungs, interfering with the body's ability to efficiently exchange oxygen and carbon dioxide. The process involves plaque formation in the pulmonary arteries, reducing the amount of blood reaching the lungs. This can lead to a feeling of shortness of breath, especially during physical activities or stressful moments. As the lungs' ability to oxygenate blood is impaired, the unmet need for oxygen can trigger physiological responses, resulting in difficulty breathing. People may also experience palpitations due to clogged arteries. The presence of atherosclerotic plaques in the arteries can cause irregularities in heart rhythm due to insufficient blood flow to the heart. This can result in palpitations, a sensation of rapid, irregular, or strong heartbeats. As the heart tries to compensate for the lack of oxygen, the organ's electrical system may be affected, leading to these rhythm changes. Palpitations can be perceived as a fluttering sensation or heartbeats outside the regular pattern. Another symptom of extreme importance is heart failure. Chronic atherosclerosis can lead to heart failure when inadequate blood supply due to obstruction in the coronary arteries results in progressive damage to the heart muscle. The heart's ability to pump blood efficiently is compromised, leading to symptoms such as fatigue, shortness of breath, leg swelling, and difficulty in performing physical activities. Heart failure can be progressive and requires medical treatment to improve the quality of life and prevent serious complications. We cannot overlook the most impactful, which is a heart attack. A heart attack occurs when an atherosclerotic plaque ruptures, triggering the formation of a clot that blocks blood supply to a part of the heart muscle. This results in damage to the heart tissue and can lead to cell death. Symptoms include chest pain or discomfort, which may spread to the arms, neck, jaw, or back, difficulty breathing, intense sweating, and nausea. Urgent medical intervention is necessary, such as performing an angioplasty procedure or administering thrombolytic medications to minimize heart damage. Another serious issue pointed out is cardiac arrhythmias. Atherosclerosis can affect the heart's electrical system, leading to cardiac arrhythmias such as atrial fibrillation or ventricular tachycardia. These changes in heart rhythm can increase the risk of serious complications, including stroke and heart failure. Treatment may involve antiarrhythmic medications, ablation procedures, or, in severe cases, the implantation of electronic cardiac devices. Recurring dizziness is also one of the symptoms. As the brain receives less oxygen, cognitive function and coordination may be impaired, resulting in sensations of dizziness or instability. These dizziness episodes can be triggered by rapid changes in position, physical exertion, or, in more severe cases, may occur spontaneously. Dizziness, when associated with artery problems, indicates the need for cardiovascular evaluation to identify and treat the direct cause of the problem. Also, pay attention to sudden weakness. Sudden weakness is a symptom that can occur when clogged arteries compromise blood flow to critical regions of the body, such as the brain or limbs. Lack of oxygen and essential nutrients can result in a sudden loss of muscle strength, causing weakness. In more severe cases, this can progress to the inability to move a limb or even fainting. Sudden weakness is an alarming sign that requires immediate medical attention, as it may indicate an acute vascular event, such as an impending stroke or critical compromise of blood supply to vital organs. Another important factor is leg pain while walking, known as claudication. Claudication is a common symptom of clogged arteries, especially in the arteries of the legs. Atherosclerosis can reduce blood flow to the muscles of the legs, resulting in pain while walking, known as intermittent claudication. During exercise, muscles demand more oxygen, and the decreased blood supply results in leg pain. This symptom can limit a person's ability to walk long distances and serves as an indicator of obstruction in peripheral arteries. Men may also experience erectile dysfunction. Atherosclerosis can affect the arteries that supply blood to the male genital organs, resulting in erectile dysfunction. Reduced blood flow to the penis can compromise the ability to achieve or maintain an erection. Erectile dysfunction related to atherosclerosis is often an early sign of broader vascular problems and may indicate an increased risk of cardiovascular events. Another worrisome aspect to be attentive to is persistent high blood pressure. The presence of clogged arteries can contribute to high blood pressure. Artery obstructions increase resistance to blood flow, resulting in an elevation of blood pressure. Persistent hypertension can damage arterial walls over time, further increasing the risk of cardiovascular complications such as heart attacks and strokes. Advanced cases can even lead to changes in vision. Arteries supplying the retina can be affected, leading to changes in vision. Inadequate blood supply to the eyes can result in blurred vision, loss of peripheral vision, or even blindness in extreme cases. These visual changes indicate serious complications and require immediate medical evaluation to prevent permanent damage to vision. These are alarming signs that your body gives when the arteries in your body are clogged. From simple symptoms like dizziness to severe cases like a heart attack. Knowledge, like what we provide here on our channel, is the primary key to prevention and early detection of the problem. So, leave your like, subscribe, and activate the notification bell. Check out other important videos here to help you read the signs of your body. Thank you for watching, and until next time.